Imagine this, you're in the middle of your high school district championship game when all of a sudden you get nailed in the head. For a moment you stumble around trying to gather what just happened to you. You're then met by throbbing migraine and you just can't quite understand what is going on around you. This is often what it feels like when you get a concussion. I personally have suffered from 4 concussions in my life and I still experience symptoms today. I've done much research on this topic throughout those 4 concussions I had, and I continue to inform myself on those protocols today. Concussions are a lot more common than you think, so I'm sure that most of you have experienced one yourself or at least know somebody who has. Today, I will be introducing you to the acute and chronic symptoms of concussions, what post-concussion care looks like, and finally, how you can help prevent them. First, I will be defining a concussion and explaining what those acute symptoms look like. According to the CDC on their online post titled, "What is a concussion?" a concussion is defined as a traumatic brain injury caused by a blow to the head or a hit to the body that causes the head and neck to violently move back and forth. This can be caused by a ball to the head, a car accident, or a fall. But for the sake of this speech, I will be focusing just on sports-related concussions. The acute symptoms of a concussion can range greatly and also can be put on a spectrum to help doctors diagnose its severity. The most common symptoms are headaches and dizziness, according to Dr. Margot in her medical journal titled The Acute Symptoms of Sports-Related Concussions, Diagnoses, and On-Field Management. Other symptoms include sensitivity to noise and light, temporary memory loss, confusion, irritability, and even a loss of consciousness at that point of injury. So now that we have learned about what a concussion is and what those acute symptoms look like, I will next be explaining what those chronic symptoms of a concussion look like. Unfortunately, it is near impossible for scientists to narrow down the apparent chronic symptoms to be caused by concussions, since the symptoms often overlap with other underlying issues like PTSD and depression. In a study conducted by researchers out of the New York School of Medicine and Stanford University, published on the 15th of February in 2016, results concluded that patients with a history of concussions had an overall reduced information processing efficiency and a higher fatigability. These deficits were found to be associated with the original concussive injury even after accounting for the developed symptoms. These other symptoms included chronic migraines, irritability or mood changes, depression, anxiety, and the list continues on. I personally still experience migraines, vision problems, balance issues, and even issues with memorizing or remembering things for school. Now that we have learned the many possible symptoms of concussion, I will now be next explaining what current research suggests for post-concussion care. Every case is different and varies greatly from person to person. Because of this, there is no explicit recovery plan that works for every person every time. What I mean by this is just because one way worked on one concussion, it doesn't mean that it will for the next one. According to a newspaper article written by the American Osteopathic Association, written on February 1st of this year, the protocol for post-concussion treatment has changed dramatically. The recommended changes are care include advocating for early activity, recognizing pre-existing conditions, like I mentioned in my previous point, and educating athletes about concussion recovery. From the time I had my first concussion to my 4th, I myself saw these changes. Previous research suggested that the patient be completely isolated with no stimuli. That includes no light, no noise, nothing. Basically hibernating, because the best way to pass the time was sleeping. Now, research says to start low intensity cognitive or physical activity 24 to 48 hours after the injury. This promotes healing in the brain and allows for athletes to return playing faster and safer, which is all, athletes want to do in the first place. I'm sure all of you must be wondering now, how can I prevent this from happening or reduce the severity of a concussion? The number one prevention of concussions is concussion education. Luckily, with this speech, I've helped with that very first step. Charles H. Tater explained in a medical journal titled Sport Concussion Education Prevention that enhanced educational strategies are required to ensure that individual participants, sport organizations, and healthcare professionals recognize concussions and manage them proficiently according to an internationally recognized guideline. Other preventions come with coaches and other supervisors enforcing the rules different sports have in place to help minimize the risk of sports-related concussions. This includes no body checks in hockey or no helmet tackles in football, and the list goes on. Another lesser-known prevention is actually being hydrated. In a medical journal by James E. Clark and Emily Sorolis, published on July 30th, 2020, research has found that dehydration can limit the ability of the tissues and the cerebral spinal fluid to withstand the pressure wave of impact. This means that when you're dehydrated, your body produces less cerebral spinal fluid, which is what your brain sits in and helps protect your brain. And so the tissues are more easily damaged. If there's less protection, there's more damage, and that's what causes the concussion. As I've shown you today, concussions are so very complicated and hard to treat. I've discussed the acute and chronic symptoms of concussions, what post-concussion care looks like, and even explained ways on how to prevent them. Because I have suffered from 4 concussions myself and still struggle today with those symptoms, I hope that by educating, I could help prevent others from my same fate. My key takeaways from this are to stay hydrated and stay educated. Thank you.